Spotlighting Hawaii's leaders.
We want to bring in Governor David Ige.
Good morning, Mr. Mayor.
Lieutenant Governor, good morning. Thanks so much for joining us. Mayor Derek Kawakami.
Thank you so much, Senator, for being here.
Spotlighting the issues.
Where is the virus right now in our community?
How much is this overall going to cost the state?
How are you responding to the community's concerns? Talk about the level of citations that you guys are writing.
Spotlight Hawaii with Yanji Denise and Ryan Kalei Suji on the digital platforms of the Honolulu Star-Advertiser. This episode of Spotlight Hawaii is brought to you by Chaminade University.
Well, aloha and good morning. It is the start of a new month. I'm Ryan Kalei Suji, joined by Yanji Denise here on this September 1st for Spotlight Hawaii. Thank you so much for tuning in. Earlier today, we had originally planned to have Dr. Ashton on from Hawaii Pacific Health, but like so many other in our healthcare industry, they are busy working and working on those front lines and taking care of many COVID patients that we are seeing in our hospitals. And so we'll try to get Dr. Ashton on this program later this month or looking to next month. But Yanji, we have two very important guests to talk about an order that was recently announced earlier this week.
That's right. Mayor Blangiardi unveiled the Safe Access Oahu program. To talk about that, we've invited Hawaii Restaurant Association Chairman Greg Maples, along with Honolulu Office of Economic Revitalization Director Amy Asselbaye, to join us about how this program is going to work, both as from the customers' perspective, and then also from the vendors' perspective. This goes into effect in just a few weeks, and so I know a lot of folks are trying to figure out how this is going to work. So, Amy, let's start with you, just the nuts and bolts of what this program is for those of us, who are just getting sort of familiar with what the policy will be. Can you lay it out just in the simplest terms? How is this going to work and who's affected?
So the Safe Access Oahu program was created in collaboration with public health leaders, business leaders, and restaurant leaders. It's a part of the city's community-based strategy to make Oahu COVID safe. We know that wearing masks, practicing social distancing, and then ultimately getting vaccinated are how we help to beat back COVID. So Safe Access Oahu builds on the earlier orders from Mayor Blangiardi to keep Oahu safe. First, he implemented a requirement for city and county of Honolulu workers to be vaccinated, and then he has recently suspended large events and limited the size of gatherings for 28 days. So Safe Access Oahu really creates safe spaces for employees and customers so that they can feel confident that the people around them are fully vaccinated or they've had a recent negative test. We're already starting to get a lot of questions from businesses and community members about Safe Access Oahu. So we've created some tools for people to learn more about how it will be implemented. And I think the best place people can go and read first and foremost is oneoahu.org/Safe Access Oahu. If you Google Safe Access Oahu, it will basically lead you right to that site. But again, oneoahu.org also has information on testing and vaccination access and other links to phone calls you can make to help implement vaccinations and or testing for your employees.
Yeah, we've certainly seen that site expand over the past year as COVID has continued to evolve, and great to see that up and running. Greg, I want to send things over to you now. Obviously, this new order directly impacts the restaurant industry and hospitality industry. What are you hearing from the restaurants that you represent, and how are the restaurants preparing for this new order?
Well, first, thanks for having us here. This is a great opportunity to talk a little bit about how we got to this point, and a big shout out to the governor and the mayor for allowing us to be at the table to at least be part of the discussions. And I want to be very clear about something to all the restaurant owners and operators out there. There was a mandate of some sort coming, and it was the talk was shut down, dining room shutdowns, a passport like we have now without a testing option. We're grateful that we were able to be there to try to help guide that conversation by giving our feedback. So right now, I got to be honest with you, the restaurants are not happy. I mean, listen, restaurant owners and operators have been on the front lines, literally fighting for 18 months. They're tired, they're worn out. We almost were out of this, and a lot of them are sitting on piles of debt. They're sitting on mounds of rent that has to be paid, and it's really tough. And so, we understand the restaurant owners and operators, first and foremost. Listen, these are some of the greatest people that you'll ever meet, and they know that the counts got out of control and that something had to be done. They know that. I will say this, and I say it on behalf of them, is we know that no matter what happens, the COVID problem in Hawaii can't be solved by just limiting and restricting the restaurants. It's got to be a complete community outreach, and we've got to come together as a community. Right now, our restaurants are, they're upset. They're disappointed because we're already seeing, three things are happening. So let me just go through it real quick. One is we're heading into the slow season. So as we go into September, our sales go up. They go down anyways. We have sales decrease as soon as the governor made the announcement to not come to Hawaii. It wasn't a safe time. We saw restaurant sales go down. And since the announcement of the Vax passport, we've seen sales go down again. So they're in a tough spot. They understand that it's important, but they're in a tough spot because the sales are declining for those three reasons.
Sorry, Amy, I want to bring you in. So let's talk about this sort of on a practical level. We're talking about restaurants, also entertainment venues. There's a host of businesses that are affected by this. How do you actually envision this? Let's say I'm a customer, I'm vaccinated, I have my card. Is there someone at the door who's checking that? Do they check it once I'm seated? How do you actually expect this to work? Just, sort of the nuts and bolts of actual implementation.
Right. We expect at the venues that are impacted by this order, which again, to be clear about what they are, check out oneoahu.org/Safe Access Oahu, and you can see if your business is one of those that is impacted. If a customer is just coming in and going to spend less than 15 minutes in a business, we already know that that customer is required to wear a mask. So they can enter the business, pick up their takeout order for food or whatever it may be and leave, and they would not be impacted by this order. If a customer is going to dine in or spend more than 15 minutes in that entertainment or recreation venue, then they will need to show either the hard copy of their vaccination card. They may show a digital photo copy of it. So you could just hold up your phone with your photo of your vaccination card, or sites like the Safe Travels Hawaii. If you have uploaded your vaccination card to that site, you should also be able to use that application to share that you are a vaccinated customer, and you will be allowed to come in and either dine or participate in the recreational activity.
And Amy, has there been any talk with maybe state or on the county level of developing an app or something that may assist in this process of a vaccination verification so that it doesn't put the responsibility back on these restaurant establishments? We know that in similar cities like New York City, they have developed this sort of verification app. Do you know if there's any talks or any plans in the work that may help to alleviate that responsibility of the restaurants?
Yes, and I am not actively involved in them, so I don't think I'm the best person to respond to that. But our state, having developed Safe Travels Hawaii, is in the best position to implement an app or any other kind of tool where a vaccination card could be validated through that process.
So, Greg, for your members, they are now in the position of having to verify these vaccination cards. What have you heard from your counterparts in other cities like San Francisco and New York that have taken this on, and what are their experiences? What can we learn from them?
Yeah, so that's a great question. We've been in contact with other cities, and we've even been talking to Guam, who has implemented something similar to this. And the things that we're hearing are things that we expected. We're going to need to retrain our hosts and hostesses that they're going to be able to recognize what a card looks like, whether it's from Japan, China, Europe, mainland, whatever, and how to read quickly the negative test. Remembering that our folks aren't medical professionals. So we're gonna have to teach them how to, and other people do it. You go to a 7-Eleven, they card you for alcohol, and they have a process, and we're going to do that. We also are going to train. What we've learned from the other folks is that we need to train right away on de-escalation, because there have been issues and there will be issues where people come in and they're upset. This is a very divisive, people are very divided about how they feel about this. And and our restaurant folks, I just want everybody to be clear. They didn't ask for this. They didn't do this on purpose. So when you go to visit a restaurant, please be kind. We're doing the best we can with what we have. So don't be upset at the hostess or the manager. This is something that was handed to them, and they're going to do the best they can. But we're going to need to teach de-escalation tips for them. And then things that we've heard also is we need to be nimble. And the mayor has been really good about listening to us about, as we go on, what might need to change, what are we learning. And as we get more information, we will put that out as the HRA to all of our members and to all restaurants. We have a 7,000 person email list, and we want to send it out. We've got a lot of training that we're going to be doing. We're going to provide the access to posters and anything we can do to help get people trained. But that's what we've learned from other places.
And Amy, in that regard, where Greg is talking about the restaurants having to train their employees, how is the city helping the restaurants themselves with this implementation? I mean, is the city providing any assistance or guidance to the restaurants so that they are equipped and know what to do to implement this system?
Right. We have our initial guidance up on the website at oneoahu.org/Safe Access Oahu. But additionally, we're gathering more information from the city's HR resources and other HR and legal professionals to provide really strong guidance to help, where Greg said, in communicating with both customers and employees about the requirements under Safe Access Oahu. But I just want to be clear too. I don't think this is something the mayor asked for either. I think the surge in the Delta variant, the only way we can deal with it is collectively together. And instead of shutting down our economy, instead of keeping people at home, this is an alternative to keep people both safe and protected from contracting the COVID-19, contracting a COVID-19 infection, but also allowing our businesses to stay open and for commerce to develop. Some of the restaurants that have already implemented vaccine mandates and publicized that to the community have actually seen an increase in their reservations because the customers who are vaccinated feel safe and more comfortable going to a place where they know they won't be exposed to the COVID-19 virus. So it's a really tough situation, this huge surge in COVID infections. And we feel that this is a measure that can help to increase vaccination rates. And we'll see at the end of these 60 days if it does that. And it will improve anyone's opportunity to go outside to be less likely to contract COVID-19.
Amy, I want to stick with you and this question we have from Heather. And she says, I spend more time in Costco than at a fast dining restaurant. What made you choose which businesses to mandate? It's not just restaurants, as we mentioned off the top. It's also gyms, fitness facilities, bars, and what have you. But what made you decide certain businesses as opposed to others?
So the mayor, as Greg said, created this order in consultation, not just with the business community, but also with the public health community, and looking at the data and the science where infections are happening in our community. And infections are much more likely to happen when unassociated people are gathered indoors and they take off their mask. And so when those situations occur, or in the situation that may occur, this is specifically what that order is directed towards. So if a person goes to Costco, if a person goes to the grocery store, if a person goes to a florist, they are expected by our mask mandate to walk in that store and to keep their mask on for the entirety of the time that they're there. we're looking at the data and science where transmission risk is much more high and trying to address that with Safe Access Oahu.
Greg, on your end, of course, we know that many restaurants were having a hard time filling some vacancies and some posts after COVID-19, with people, still filing for unemployment. How do you feel that this order may impact those establishments now with the requirements of this testing and vaccine mandate?
Yeah, so before this mandate came, we had really three big problems we were dealing with in the restaurants: capacity, which we were at 50%. We 25 outside, 10 inside for the gathering, for the seating at the table. Staffing was a huge issue, and then our supply chain, which continues to be an issue. The staffing was an issue because we just didn't have anybody who would apply. And now what's going to happen is I believe we're going to see restaurants that employees will not want to be tested, or they're not going to want to get the vaccine and they'll leave. But I have to say this. Our owners and operators love their employees, and they're going to work really hard to try to keep everybody that they have. We know we're going to lose some. And, to answer your question, this isn't going to help the situation with staffing, but our restaurant owners and operators, these are incredible people. They're going to do all they can, I'm sure. But we're going to lose some people, and that's going to be really tough on the restaurants.
Greg, I want to stick with you. One of the other things in the mayor's order is also a 10 p.m. cutoff now for serving alcohol. What are your thoughts on that, and how is that going to impact your members?
Yeah, so I think it's important everybody remember the reason why the 10 p.m. liquor cutoff came. And it was from feedback from the health community that said that their ERs are filled. They get a lot of business after 10 o'clock until the wee hours of the morning from traffic accidents and other issues that are related to alcohol. And so when the mayor, in consultation with them, decided to cut that off at 10 p.m., we were grateful, because there was some talk about doing it earlier and going back to even some stricter things. But the 10 p.m. cutoff, it's going to be tough for some restaurants, but it's certainly something we can live with if it's for 60 days.
Amy, a question for you in terms of the enforcement side of this. How will the city be able to keep track of these businesses and restaurant establishments? And if they are following this order of, checking for vaccination verification upon entries, is that something that the city will actively be pursuing?
So the city's chief method for compliance is to, first and foremost, hope that the businesses take positive action, implement the vaccine or testing regimen, and then they'll upload their documents to a city website. So we will have a spreadsheet basically of businesses that have submitted their information for compliance. But on top of that, it would be basically a complaint-driven enforcement that the HPD or our liquor commission would go to establishments that there is some concern that they may not be complying with the order. And then at that point, the HPD or liquor commission would have the discretion to, issue a fine or other citation. The liquor commission also has the authority, as you know, to close down bars. If it's okay, there's one thing I would like to just share with regard to some recent research that the University of Hawaii UHERO actually conducted regarding local businesses, vaccinations, and testing. So they surveyed nearly 900 businesses on Oahu, and most of them were small businesses with less than 10 employees. So it's a statistically significant sample. But of that sample, more than 80% of the businesses reported that most of their employees have already been fully vaccinated. So that's a significant number. 80% already know that their employees are fully vaccinated. 65% of the businesses said that they already do or likely will require their employees to be vaccinated. Now, this was before Safe Access Oahu was implemented, so we took that as a positive sign that businesses were moving in this direction anyway to protect their employees and to protect their customers. Finally, 61% of businesses said that they already do or likely will require unvaccinated employees to be regularly tested for COVID-19. So I just wanted to share that information And hopefully, it's another piece of understanding the reasons for implementing Safe Access Oahu.
Amy, one of the things I was looking on the oneoahu.org Safe Access Oahu website, and one of the things that caught my eye, and there's a lot of information there, and so I encourage everyone who's watching today to go check it out, because this is going to affect all of us if you like to go out. One of the things there that I noticed was that if you have an outdoor area in your establishment, those folks don't necessarily need to have vaccine verification. Can you explain how that's going to work? Will there essentially be a indoor portion that's vaccinated and outdoor portion that could potentially be the unvaccinated section, like a smoking and a non-smoking?
No. The Safe Access Oahu requirement is that if you are dining in a restaurant establishment, whether it be on a patio, a lanai, near an open window, or indoors, you will be required to either show vaccination or to show that you have had a recent negative COVID test. So it applies for those who also have set up outdoor dining.
But it does not apply to, let's say, a food truck.
That's right. Food trucks, restaurants that have stuck through COVID with takeout only, a coffee shop, those places we expect that a customer would be in and out in terms of their service with their mask on in less than 15 minutes, and therefore checking vaccination or for a negative COVID test would not be required.
Greg, when you look back to just a few months ago, there was actually an option for restaurants to implement this vaccine verification and be able to open up with even more capacity if they implemented that portion into their business model, if you will. And then, of course, we saw the rise, and then more restrictions ultimately led us backwards. But a lot of things that we've heard from restaurants at that time was that it was just too much work for them to kind of carry this on and this obligation. Do you think that has changed at all because of Delta and because of conditions, or do you still expect some of that pushback?
Yeah, pushback from the restaurants?
Yes.
Yeah, I think so. Here's what's going to happen is you're going to have some sophisticated restaurant owners and operators who are going to figure this out and do it really quick. And then we're going to need to work with the folks that may not get the information as fast and they don't know exactly what to do. And that's where some of the pushback might come. But just remember that there's so much division when it comes to every piece of this. About the mandate. There's people divided about, having a mandate. There's people divided about the vaccine. And so those attitudes rest inside the restaurant world as well. But at the end of the day, restaurant owners and operators want to keep their employees safe. They want to keep their guests safe. And I'll tell you a story. I had an owner who came to me and with a very emotional moment, she said to me, having weathered this for the last 18 months, she said, Greg, I just want to sell pizza and beer. I just want to sell pizza and beer. She put her life savings into this, and that's what she wants to do. And so we need to remember that that's where those folks are, where a lot of these folks are at. We're going to do as an HRA everything possible to help that kind of person. We're going to give them all the information that we can. We're going to be there to support them. And we're going to work with our government officials, and we're going to stay at the table and do everything possible to do the right thing. And as is obvious, and I agree with Amy. I don't believe the mayor wanted to do this. I know him, and I know what the governor's been saying. The last thing they want to do is impede on this economy, regardless of what the naysayers are saying. I promise you, I've been in enough meetings. This was coming, and it's not because they wanted it. And I'll just say this: we're at a critical point in our community. We have the ability to act, or we have the ability to be acted upon. And what I have counseled is we need to act, and we need to act as a community, as a family. We counsel together to find out what is it we can do different and better today to get us through this 60-day time period. Because my guess is, and I think I'm guessing pretty good, when we do see this go back down and we see the hospital beds open back up, I'm confident the mayor and the governor are going to let us get back to normal. That's what their goal is, and that's what all of our goal is. But we all need to own this. And I'm so grateful for there have been restaurants and businesses Banks that have already done this ahead of time, they've already mandated, they've already put in testing. Some of them have been doing it for months and months and months. More people need to do that. Churches need to look into their congregations and ask, what can we do different today to help in this process? And I hope that's what the next step for our community is.
Amy, this program is supposed to sunset or at least be reviewed after 60 days. What is the sort of measure of success? How will we know this has been successful, and would this potentially be extended to other businesses, or do you actually expect it to end in 60 days?
So there is no singular metric that the mayor, public health officials, and the business community that has worked with him on determining this order. But certainly one goal that we hope to see occur through these 60 days is that more people on our island will get vaccinated, because vaccination is our best weapon against COVID. That is what really can reduce the hospitalizations, which is creating such a huge strain on our health system. But mainly, this program is just one part of an overall community-based strategy to contain the spread of COVID, to make Oahu COVID safe. We also need to continue to keep up testing, which there's many free testing sites. Again, you can find those resources on oneoahu.org. We also need to social distance. We also need to wear masks. So we're continuing to encourage those things, with the state and the city making the vaccination sites more available around the community, and also the testing to help employers in implementing this mandate, that they'll know and easily be able to access the regular weekly testing if that is needed.
I want to bring in one final question here. This is an interesting question from Rick asking, are people going to need to show ID along with their vaccination cards? Is there any sort of requirement for positive identification to match up the vaccination card with the individual that is presenting that?
I think that is going to be a part of how this is ultimately fully implemented. The questions that we've received so far have been about, like, if a child comes into an establishment that is under 12, how can we verify their age and that they can't be vaccinated at this point in time? So we won't, in answering that question, we of course wouldn't require a child under 12 to have an ID, but those who are showing their vaccination cards, I think we're going to have to verify that those are legitimate. We are not asking our restaurants to be police. So we definitely hope that, they're looking for the right thing, which again, we will be posting, a clear identification of what a CDC vaccination card looks like, what it looks like when it's been uploaded to the Safe Travels Hawaii website. So it'll be clear for businesses to know that they're looking at the correct information and a valid card. But at the same time, businesses may think they see a fraudulent card. And so there is information, again, on our website for how to report if a business thinks they're seeing a fake vaccination card.
We are almost out of time, but Greg and Amy, I want to give each of you an opportunity for a final thought this morning. Greg, earlier you mentioned that part of the training for restaurants is going to be in de-escalating things, because there could be a lot of, tempers flaring on this issue. What's your final message to the community as we, embark on this new venture? In about 2 weeks, this will be in full effect. So what do you have to say to people today about how to go about this?
So my plea is to be kind to your restaurant when you go there. Remember, they didn't ask for this. And so be kind to them. And the other message is, we need you. We absolutely need you. Please don't stop going to the restaurants. If you're unvaccinated and you're not going to get vaccinated, please do takeout. Please come and get your food from us. We need you. We love you. We're part of the community. The other thing to remember is that the people that work in these restaurants are just like us. They are members of our community. And if we don't continue to eat at our restaurants, it's going to affect them. So our plea is, keep coming. We appreciate and love you. And
Amy, a final thought for you as we wrap up this morning.
I would just say that the economic outlook for Oahu and our entire state depends on defeating COVID and keeping our community healthy. We know that the health of our community is the health of our economy. And this uncertainty caused by COVID-19 is starting to lead to some slowness in our recovery. So I just want to, be clear, we're working on programs to make sure that we continue to inject some of the federal relief dollars into the economy. We're working with the businesses that will be impacted by this order, and we're all in this together. So thank you for the opportunity to share some more information via Spotlight today.
Thank you both for being here this morning. We really appreciate your time.
Aloha,
Thank you.
Aloha.
Thank you. And we would encourage you again, as Amy mentioned, the oneoahu.org website / I think it's / the name of the program will get you there, or you can just search the name of the program. And, there's a section there for customers. There's a section there for vendors. It lists all the types of businesses that are affected, how you register your business, and also just from a consumer standpoint, what you need when you're entering an establishment, because there will be, sort of a learning curve on this, but this is coming, like it or not. In about 2 weeks, it's going to be implemented for a minimum 60 days, and then the city will reevaluate whether or not to continue it. It was interesting to hear Amy say there's no single metric to determine whether or not this is successful. They really are just looking at sort of infections and impact overall. And then, a plea there from Greg, Ryan, to really be compassionate to the people who actually have to implement this.
Yeah, you really heard that plea from him at the end there, saying that this is something that they know they had to do and that it was coming. Certainly not the position that they wanted to be in, but they recognize their role in this and that they will do all that they can to support the members, but are also asking for the community's help, for the patients as well of the community as they go into restaurants and establishments, because there will be some learning curve involved in that. And again, that's oneoahu.org / Safe Access Oahu is the site I believe you're looking for. That is the site for more information about this. And really, oneoahu.org has become a central hub that has not only information about this program, but a bunch of different other information about testing availability and vaccination efforts that are happening, as well as the order itself. So for those who maybe have questions about if this is a order that will impact my business, they have all that information on their website. You can find more about that and all those details listed there as well.
Yeah, very important resource. We started the day looking at the number of infections, 455 cases reported today, sadly 13 deaths. Where is the infection right now? Where are we seeing the clusters? We're going to be talking about that on Friday with the state epidemiologist, Dr. Sarah Kimball, and really trying to understand where we're seeing this. We know a lot of you have concerns about kids in schools. So, what is the source of those infections in schools? Are schools still safe? What are the measures that are being taken there? Dr. Kimball has been very, very involved in all of those rollouts. And so we're really looking forward to our conversation with her.
And also getting an update on the contact tracing program that she also oversees, knowing the responsibility that they have and the amount of work that has now been placed on their shoulders with this rise in cases, where they are with those contact tracers and how they are keeping track and identifying the cases in our community. We'd love to hear from you and see you back here on Friday at 10:30 for that episode. We thank you all for being a part of our conversation this morning, and we'll see you back here on Friday. Aloha.
Aloha.
This episode of Spotlight Hawaii was brought to you by Chaminade University.